Hello, aspirants, and a very warm welcome to today's Explainer. We are diving straight into a highly critical document that has just been released, the National Family Health Survey 6, or NFHS-6. This data covers the 2023-2024 period, and trust me, unpacking these insights is absolutely essential for your general studies preparation. Exactly. Let's get right to the biggest headline here, which is 90.6%. Aspirants, you have got to commit this number to memory. Institutional deliveries in India have surged to 90.6%, up from 88.6% in the previous round. That is absolute gold standard, mains fodder for your GS Paper 2 answers regarding health and social justice. And when we look at the progress tracker, you can really see where these concrete improvements are happening across the board. Comparing the 5th and 6th surveys, antenatal care in that crucial first trimester has jumped to 76.2%. Plus, mothers consuming iron folic acid supplements for 100 days or more, that's gone from 44.1% up to 54.9%. We're also witnessing some really positive upward trends in health insurance coverage. These are the hard facts you need to have ready to quote in the exam hall. Moving on, let's break down how this impacts child health metrics. And remember, this is the first comprehensive survey conducted post the COVID-19 pandemic, so the data is highly significant. Stunting among children under 5 actually saw a massive drop from 35.5% down to 29.3%. Severe wasting also fell from 7.7% to 5.2%. Now, the underweight category only slipped marginally from 32.1% to 31.8%, but the big takeaway here, when you're tackling questions on poverty and developmental issues, these exact percentages are your best supporting evidence to show real positive momentum on the ground. Okay, shifting our focus slightly to demographics. The total fertility rate, or TFR, has basically stabilized at 2.0. Now, note that carefully. That is just under the crucial 2.1 replacement threshold. When you couple that with contraceptive prevalence rising to 69.1%, this connects perfectly to India's demographic dividend discourse. For your GS1 society syllabus, this stabilization is proof that population control measures are truly taking root. Absolutely, and we really have to highlight the huge triumph in universal immunization. We're looking at 95.6% of children receiving vaccinations through public health facilities, which is fantastic. Full vaccination coverage is now sitting at a solid 87.1%. But I want you to specifically note the rotavirus vaccination coverage. It literally surged from 36.4% all the way to 85.4%. The second dose of measles also climbed to 71.8%. Jot these down because these are undeniable, clear-cut successes of our public health infrastructure. Section 1, the hidden challenges, critical analysis for mains. Now remember, UPSC examiners don't just want a simple list of achievements, they heavily reward aspirants who look beyond the positive data and critically analyze the emerging threats we still need to tackle. Precisely. And a glaring red flag pops up when we compare international guidelines with our reality. The World Health Organization recommends an optimal C-section rate of around 10 to 15%. But the survey found that overall C-section deliveries have sharply increased to 27.2%, with a massive spike in private healthcare facilities. In urban areas, it is sitting at a highly concerning 40%. You absolutely must highlight this in your critical evaluations as a prime example of healthcare commercialization and over-medicalization. Building on that critical angle, the survey actually flags some specific terms that examiners are going to be actively looking for in your high-scoring mains answers. Note the dual burden of undernutrition coupled with increasing adult obesity. Then there's the rise in NCDs, non-communicable diseases, and persistent lifestyle-related risks. These are the exact keywords you need to drop when discussing contemporary health challenges. So, to wrap up today's Explainer, we want to leave you with a classic, thought-provoking UPSC interview prompt. Despite rising institutional deliveries, how do we address the surge in private facility C-sections? Take this question, chew on it, and brainstorm some multidimensional policy solutions. Think regulation, awareness, and strengthening public health. Keep studying hard and use this data wisely to really elevate those mains answers. Good luck, aspirants!